status of Mozambique is dismal. They have the third worst HDI value among ranked countries and remain trapped in the cycle of poverty. It is imperative that we take action now in addressing the issues and creating and implementing an action plan to improve the quality of life in Mozambique.
The burden of disease in Mozambique is incredibly high. In 2007, the health-adjusted life expectancy was a shockingly low 42 years. DALYs are the main health indicator used to measure the burden of disease. They paint a picture of the true health status of a country, taking into account years lost to illness, disability, and premature death. WHO's 2004 report on DALYs shows that the top 3 causes of DALYs are HIV/AIDS, perinatal conditions, and malaria. According to 2010 data, Mozambique's DALYs caused by HIV/AIDS represents approximately 4.72% of the global number of DALYs due to HIV/AIDS. Yet, in 2010, Mozambique's population was only about 0.34% of the total world population at that time.
The top 3 main public health issues in Mozambique are HIV/AIDS, perinatal conditions, and malaria. There are many factors for HIV/AIDS, including unprotected sex. Some of the perinatal risk factors include inadequate nutrition and poor access to safe drinking water. The main risk factor for malaria is being bitten by mosquitoes carrying the malaria parasite.
As resources are finite, we must focus our attention on the most at-risk populations. These include women, children, and people living in rural areas. Women are more susceptible to contracting HIV due to biological factors and the fact that men take advantage of them due to their low social standing and the nature of the culture. Children can contract HIV/AIDS from their mother and are more at risk due to increased susceptibility to pneumonia, malaria, and diarrheal diseases. Rural dwellers are at a disadvantage due to lower income, less education, less access to medical services, and having a weak political voice.
In light of Mozambique's high burden of disease and vulnerable population groups, it is clear that immediate intervention is necessary. We suggest continued efforts in implementing routine HIV testing and free medication provision, particularly for mothers. We also recommend educating the population using tools like the ABCs of preventing the sexual transmission of HIV.
Possible interventions for perinatal conditions mainly involve educating mothers on how to reduce risk factors. Success in addressing perinatal conditions will also be achieved as a byproduct of generally improved health services, water and sanitation, and nutrition.
For malaria, we recommend an increase in funding toward the existing malaria operational plans and increased focus on providing reliable drugs at a discounted rate for those who can't afford them. We also recommend having insecticide-coated mosquito nets available at medical centers.
On a general level, it is necessary to improve the healthcare system by providing more medical staff, giving basic medical training to local workers, and obtaining more general medical equipment. If Mozambicans are educated and emphasis is put on effective treatments and preventative measures, we hope the prevalence of these diseases and conditions will decrease.
It is easy to outline what we wish to accomplish, but putting those ideas into action is the main challenge. To accomplish our action plan, we need both human and financial resources. We need to increase the health expenditure from 6.6% of total GDP to at least 8% in order to see significant results. Investing in healthcare now will pay dividends later in areas like education and the economy. We hope for funding from the Mozambican government and non-governmental organizations. For human resources, we need educated staff to train more medical professionals, the majority being administrative and basically trained workers on the ground level.
With your resources, we believe it is possible to cut in half the maternal mortality ratio and infant mortality rate over the next 15 years. We also believe it is possible to combat HIV/AIDS by beginning to stop the spread of the virus and by establishing 1 new health clinic per year for the next 15 years. We believe we can combat malaria effectively with bed nets by distributing them to 50% of the population by 2025.
Considering Mozambique's grim health status, the hope of these goals and numbers should be enough to motivate us all to take action. We believe healthcare is a basic human right, and we trust you will take the necessary steps to move forward with us, help reduce Mozambique's burden of disease, and save lives.